Neurofeedback has changed my practice, both in the room, the practical room, because before I started with neurofeedback, I did not even have a computer in my room, and now there's a whole system with the screen too, and I work more than I've ever done before, and I like that. But it's good with pauses. Yes, I work a lot. Before I started with neurofeedback, it was talking therapy, psychodynamic therapy. After, it's been not only therapy in the old way, but also talking about the brain and a lot more about educating my patients about what we're doing, about the brain and their behavior. And when we train, it's another conversation when we train neurofeedback than sitting in the chair and talking. I love EEGer community because it's so inclusive, and you get the chance to learn from the colleagues, but also from our mentors and teachers. That's changed my life, I can say, because I don't think I have so many friends, colleagues and friends around a method as with neurofeedback and with EEGer. And EEGer is really inviting you to be you there with whatever you come with. I love to be with the EEGer community, for sure. And even when I started to come there, I had a different system than EEGer, and I was welcomed anyway, and it feels very good. Okay, there's a lot of things that are challenging when you're starting with neurofeedback. At the beginning, it's putting on the sensors, the paste, and it's very sticky, and it's like a technique. You have to make them sit there on the head. But also the challenging part is also to invite the patient to understand what we are doing, and that is still, it could still be a challenge. That what are we going to talk about if they don't understand, if I'm not clear enough about what I need to know and what they need to tell me. That could be a challenge when finding out what protocol and to use and so on.
Right.
When I have a colleague who is considering starting neurofeedback, of course, I encourage them, but I also tell them that it's very good to have someone to train with them, or during they take a course. But when you take a course, you will train. But it's good to know what is this doing with us? How does it feel? And what are the outcomes? And that's what I would tell a colleague. Yeah, if you're considering learning neurofeedback, I will tell you it will make a huge difference in psychotherapy, both for the patient who is gonna be able to process a lot more easier than without neurofeedback, and the time over time will be a lot shorter. Because without neurofeedback we can talk for years, but people can still be, get panic attacks and stuff like that, have high arousal, and neurofeedback will calm their brains for sure. Well, I have had many moments where I've seen the effect of neurofeedback that I think would not have come through with just talking therapy. If someone has a hard time talking and they're talking, or someone who really, I have a story and I'm going to share it. It's a story a patient has agreed to give. I recorded it, and it's going to be on Debbie's YouTube channel. I've had patients who have been in therapy with me long time ago, for some years, and when they come back I suggest neurofeedback, whatever they come for, not if it's just a consultation, but if they come and have anxiety and yeah. So I've suggested neurofeedback, and a total different process is going on than when we met maybe 10 years ago. Today in this world, when there's lots of turmoil and wars and stress and the climate changes, it would be wonderful if more people could have neurofeedback, or if neurofeedback could be available for more people. When you calm your brain, you can think and you can plan and you can do whatever you have been planning to do. That will be easier. To me, I said to a friend that neurofeedback to the people, that would be, I mean, even before all the wars started and stuff.